So we're gonna start on our back, bringing one ankle onto your knee, getting into this nice figure 4 position. And while we're here, we're gonna start with just kind of getting into our crocodile breath again. Nice inhale, feel that abdominal wall expand in all directions. Belly out to the side and into the low back. You should feel your low back expand into the floor on the inhale. On the exhale, draw the navel into the spine. Now, as we're getting into that breath, we're going to start with a little bit of really light mobility from the hip, focusing on the knee that's elevated. As you inhale, pull that knee towards your chest. Let it move towards your chest a little bit. As you exhale, you're going to reach the knee towards the feet, feeling that light opening up through the front of the hip. Inhale, bring the knee back. Exhale, squeeze the knee away. See if you can feel that mobility deep in the hip socket. We'll do a good 5 reps on this side, and then we will switch to the other side. So with our hip mobility, we're going to kind of stick with 5 reps on each one for our initial assessment. After 5, we're going to go ahead and switch to the other side. Again, starting with just some crocodile breath from the position before we start with the knee. Feel that expansion. Exhale. Feel that navel draw into the spine. And before we get started on that knee, notice if this position with the left knee up compared to with the right knee up, just focusing on breath, is there a difference in the tensions that you're feeling in the hip on the right side compared to the left side? My left side, my anterior hip is already tighter and I haven't even gotten into my hip mobility. So I want to get that good assessment going early. So now bringing in our breath, nice expansion of the wall. On the exhale, as you draw the navel in, we're reaching that knee away. On the inhale, we're pulling that knee towards our chest. The pulling in should unload that front hip. The reach away should draw that anterior hip into a little bit of, we should feel some mobility, some length, and maybe some stretch. And again, doing 5 reps, and nice and slow. I want the speed of our reps to move with our breath. After 5, we're going to go ahead and switch back to the other side. As we switch back, I want to actively reach that knee towards the wall at our feet and kind of keep that engaged. So we're actively opening the front of the hip. Inhale into our crocodile breath, and as we exhale, we're going to lift our opposite foot off the floor, and we're going to pull that knee into our chest. See if you can pull actively from the knee. If that's really difficult, we can grab either the ankle or the elevated knee and lightly assist pulling to the chest. On our exhale, inhale, we're letting the hips rock forward lightly. Exhale, pulling knees into chest. We should feel this a little bit more deeper into the posterior hip compartment. This might be getting to where we're feeling that tightness or not in the glute space. So I want to kind of notice that. And remember, I'm still actively reaching my knee forward as I'm pulling my opposite knee to the chest. That can feel a little bit difficult to coordinate if this is a new movement for you. Once you've done 5 on that side, we're going to switch to the other side. Again, actively reaching that knee towards the wall at the feet. Nice inhale breath, filling up the crocodile. Exhale, pulling the opposite knee in towards the chest. And again, if you can do this without using your hands, then great. If you need to assist, that is okay. You can either grab the ankle, grab the leg, grab the foot, whatever you need to kind of lightly assist that pull, as long as we're continuing to reach the knee away as we pull the opposite knee towards our chest. Notice the difference, right side to left side. One of these is probably a little tighter. One side is probably a little easier to do. And that's going to be really, really important and useful information. Switching back to the other side. Again, ankle on knee. We're still actively reaching that knee away towards the feet. And at this point, we're going to let our hips rotate as if you're trying to place that elevated foot down flat to the floor. And let me do this the other way. I want to bring arms out, palms up, and nice and relaxed. Imagine this is our kind of laying in a bed of sand, and I want to make a nice imprint of my upper body in the sand. So inhale into our crocodile breath. Exhale, we're allowing our hips to rotate without smearing the sand. So I don't want my arms to slide around on the floor. I'm seeing how far can I let the hips rotate as if I'm trying to place that foot flat to the floor. Inhale, we're bringing it all the way back up. Exhale, nice rotation. Again, if you're only able to go so far without that shoulder coming up, then that's fine. Work the range of motion that you have. And with each rep, you're seeing if you can go a little bit further without moving or losing that shoulder on the ground. On the last one, as you let the hips rotate, we're going to leave the hips there. And we're going to come back to kind of wagging that knee, reaching the knee towards the feet, and then pulling it back towards the chest. It's a very light and small movement, but again, we're getting into that deep hip. That's going to get a little bit more into the anterior compartment, the TFL, or the tensor fasciae latae area of the hip. Once you got through 5, we're going to switch and do the same thing on the other side. So again, knee actively reaches towards the feet. Arms are out with the palms up. Inhale, fill up the crocodile breath. Exhale, allow the hips to rotate as if you're placing that foot flat to the floor, only going as far as you can without your shoulders sliding around on the floor. Inhale into that crocodile breath. Exhale, nice rotation. Which side is tighter? Rotating my left side over to the right is tighter than it was on the other side. I feel it more in that anterior hip compartment on my left hip. I have about the same amount of range of motion, but I can feel there's a difference in tension. On the last one, as we reach that foot over, we're going to wag that knee lightly. It does not need to be a big movement. Moving it up towards our head and then away towards our feet. Again, feeling that mobility at the hip. Once we get through 5, we're going to bring both feet flat to the floor, and we're going to shift into our Shinbox position. So I'm going to start on this side. This is my easier side. So I'm starting on my easier side because I kind of want to get a good feel for the difference between right side and left side. My left side is generally my more mobile side, because my right hip in the back moves a lot better than my left hip does. So I'm in my left side shin box. Left arm is coming down to the floor, grounding through that palm. Spiral that elbow out and away. Feel that shoulder blade pack down like you're pushing down into the floor. Feel that push elevate and lift the sternum so that we're nice and tall through our spine. We're going to inhale, focusing on the back hip. So I'm in my left side shin box, focusing on my right hip. Inhale, filling up our crocodile breath. Allow that hip to reach down to the floor. we're looking at the range of motion from touching the floor, or as close to touching the floor as you can get, into lifting up and moving that hip as far forward as you can. So hips touch the floor. If it can, exhale, we're scooping the tailbone and reaching it forward so that we're getting as straight through the front of the hip as we can. Can you feel some light mobility stretch here? Inhale, allow the hip to go all the way back down. Exhale, scoop into it. Notice how far does the hip travel and where does it feel tight, tense? Where do you feel the stretch? Do you feel it in the front, or if you're getting that knot, are you feeling it in the back? Once we get through 5, we're going to do a nice slow windshield wiper transition across to the other side. And we're going to do the same thing. Grounded palm, spiraled out elbow, packed shoulder, feeling that lift of the chest to the ceiling, nice tall spine. Inhale, filling up the crocodile breath and allowing that back hip to drop down towards the floor. This is a huge assessment point. Does this hip reach the floor to the same depth as the other hip, or is it less, or is it more? Big assessment point. Exhale, we're reaching that hip forward, scooping into it, seeing how straight can we get through the front of that hip. Now, like I said earlier in our figure 4, my left hip is the tighter, especially in the anterior. I am limited on how far forward I can go. I'm also limited on how low I can get this hip to the floor. This is a normal pattern for me. I've had 5 knee surgeries on my right knee. My left hip is the compensation hip. It compensates for true instability. I'm still missing ligaments in this right knee. It is not a stable knee, so my hip compensates tremendously for it. So I have to do this mobility work in order to keep my hip from locking up completely. But there's definitely some immobility associated with this compensation pattern. Once we get through 5, we're going to slow windshield wiper transition across back to the other side. We're going to do the exact same movement, but we're going to add in our reach and rotation. So inhale, allow that hip to drop. Exhale, actively scoop. Find the first stretch first, front of the hip. Then imagine you got a piece of bread and you got a buddy like Skeletor off in the corner, and you want to reach as far as you can to hand that bread off. Inhale, we're bringing it all the way back down, reaching the hip to the floor, filling up our crocodile breath. Exhale, draw the navel in, scoop first. Find the stretch in the hip before the rotation. Maintain that stretch in the hip as you add the rotation. This one again is a really good assessment point, not only for that front of the hip, but now we're getting into some light rotation through the spine. Notice how tight it is beyond just the hip, but how does that hip relate to the tightness of the rotation? Once we've done 5, we're going to slowly transition back to the other side, grounding our palms, spiraling that elbow, pack shoulder. Inhale, allow that back hip to drop. Exhale, actively scoop as you draw the navel in, and then imagine you're sharing some bread. Oh, this side's always so much tighter. So that front of the hip, right, left hip is tighter, and the rotation is tighter because of that hip. So this is one of those nice places to assess the relationship between tension in the hip and how that contributes to tension into the spine, low back, up into the shoulders even, really up into the neck as well. And if you're feeling significant tension differences on one side compared to the other, then I would strongly encourage doing more mobility, specifically these movements that you feel that tension difference in order to get that area, that joint to play, to move a little bit better. Slow transition back across to the other side. And now we're going to get into our folds. Folds, we're going to work through the shin. I want to reach both hands evenly through the shin. And I want to keep them square. I don't want one hand reaching further than the other. Reaching both hands even, make sure that both of the shoulders are even. And I want to reach evenly so that I'm square through the shin as much as possible. Again, I want to use this as an assessment. How does that forward fold feel? How does that feel in that glute space? How does it feel on the front of the back hip? Those are going to be, how does it feel in our low back? Those are going to be our three major assessment points for our folds. Again, nice exhale. Draw the navel in as you exhale. Inhale, filling up that crocodile breath. Once we've done 5, we're slow windshield wiper transition to the other side and doing the same thing. Again, nice even hands moving through that square shin. Hands reach nice and even as we exhale. Inhale, bringing it all the way back up. Now, again, this is my tighter side. So front of my left hip feels tighter and the glute on my right hip feels tighter. And so, again, there's a reason that the Shinbox is one of my primary assessment points. This is getting into a function of gait mechanics. Tension on the front of one hip is going to be paired to tension on the back of the other hip. That's going to create spiral tension through the spine, all down to the feet, all the way up to the skull. So we want to find these imbalances so that we can work to get as much balance back. Because if we are moving in our gait, and gait is a pendulum, and we are out of balance on one side of that pendulum, then gait is going to be somewhat of a dysfunctional pattern that's going to create some particular wear and tear issues, irritations, inflammations. The more balance that we can have through the pendulum, having access to mobility on both sides, makes our gait more efficient and more functional. So once we've done 5 on both sides, we're going to do 5 going back and forth. Nice exhale as you reach to one side. Inhale as you come back up. We'll take another inhale into an exhale. Inhale into our fold. Take an extra breath cycle as you transition from one side to the other. And go slow as you can with your breath. Nice slow inhale, nice slow exhale. And only reach as far as you can breathe. If you find that you're holding your breath at the end range, then back off just a little bit. Make sure that you have that you're able to nice open breath and not a tight, closed, or forced breath. And once we get 5 on each side, again, I want to have a good assessment here. How does it feel on that right side compared to the left side? I'm starting to feel my left hip is opening up. I'm getting a little bit more mobility into it. It's feeling a lot better as I'm going back and forth.